conduct disorder, and oppositional defiant disorder by Stephanie Warren and Eddie Ramey.
So what are these conditions? Conduct disorder, according to mentalhealthamerica.net, is a repetitive and persistent pattern of behavior in children and adolescents in which the rights of others or basic social rules are violated and not followed. The child or adolescent usually exhibits these behavior patterns in a variety of settings, including the home, school, and in social situations, and they can cause significant impairment or disturbance in his or her social, academic, and family functioning. And ODD, or oppositional defiant disorder, is a condition in which a child displays an ongoing pattern of angry or irritable mood. They're defiant and argumentative behavior. They can be very vindictive towards people in authority. The child's behavior often disrupts the child's normal daily activities, including activities with the family and at school.
What are some signs and symptoms? Conduct disorder: aggressive behavior towards people or animals, destructive behavior, which could include arson or vandalism, deceitful behavior, including lying or stealing, violating rules or engaging in not age-appropriate activities, can include sexual activities at a very young age. ODD: tantrums, arguing, defiance, blaming, spiteful outbursts, swearing, and just annoyance.
Mm-hmm. So how did these students get to where they are? So there are several different factors that are thought to contribute, but there's not one specific cause. So one thought would be that it's biological, that there's a defect or injury in the area of the brain that regulates behavior and impulse control, or there could be other underlying mental illnesses or even substance abuse that can cause or compound the symptoms. It could also possibly be genetic. So many students who suffer from ODD or CD have a history of family members with mental illness. It can also be environmental. So a lot of these students have experienced trauma or abuse, highly dysfunctional families, and a lot of them have inconsistent discipline, which can play a huge role in these behaviors. There could also be psychological issues, issues with their moral awareness and cognitive processing, and social issues such as being of low economic status or not fitting in with peers. Those can be big risk factors.
Yeah. So, how to help with this inside the classroom? Avoiding power struggles, having to relax. If the student is having a hard time and they really want to be combative, let them air themselves out, be an active listener, don't really engage inside that back and forth. Also, positive praise, constant reinforcement of the positive behaviors of the student. Reward systems would help just to reinforce that positive behavior, giving them opportunities like to be successful. Maybe set minor small goals, something that's very obtainable for the student, and just remind them that you respect and that you like them, you care about them. Just a constant positive praise, building that positive relationship, and most importantly, stay calm.
Mm-hmm. So what about for the parents? There's a lot of things parents can do. It is important for students who are suffering from CD or ODD to see a licensed professional. This is not a condition to kind of take lightly. This can be a very serious thing. So many of these students would benefit from seeing a psychotherapist. They can help them learn how to control their anger and even reshape their reasoning and social skills. And these students may even benefit from taking medication, especially for some of the underlying symptoms that can contribute. So if they have ADD or other psychological disorders, that can really help them. Parents can also do things like make sure that they have consistent and appropriate discipline within their home, that they're not aggravating their students, but that they are setting limits and boundaries. That they have appropriate consequences when they cross those boundaries. These students would also benefit from having a routine, and make sure that as a parent, you're being forgiving. These students are suffering and they do need help. So you want to be stern and have discipline and routine, but you also want to make sure that you're giving space for the students to fail and still be loved.
Great. Here's our resources, and we thank you for this opportunity.
Yep. All right.